We're going to transition a little bit. Now, remember, we've got all these things happening as we age. One of those is sun-damaged skin. If you do not have an IPL, that stands for intense pulse light. It is a foundation for facial rejuvenation. You have to have it if you're going to be rejuvenating faces. IPL is light that is filtered to treat dyschromias, discolorations in the skin. Now, because of the way that this is tuned, we have 25% more power on the new Lumecca Peak. It's the new handpiece on the new Optimus. And a couple different wavelengths, depending on what we're treating and where we're treating, in terms of dermal depths. And it's safe on all skin types. Of course, with darker skin types, you have to tune it down because it's looking for pigment in the skin, again. So just some before and afters. Again, if you do not have this, you need to have an IPL for appropriate facial rejuvenation. And I love IPLs. The reason why is very few things in my world do you get like that immediate result. Body tighten, surgery. Oh gosh, surgery. Everyone expects to be prancing around their bikini on Monday when they got their surgery on Friday. They're like 6 weeks later, they're so pissed off because the reality set in, like this is going to take a while to get to my result, right? And then there's a lot of things in our world that are like that. It just takes time. The thing I love about IPL is you smoke them that day with it. That night, they're sending you pics like, oh my gosh, look at all this sun damage that came to the surface. It's very tangible for your patients because what will happen is immediately after the treatment, this is immediate post, you will see it all pop to the surface. And then it subsequently flakes off. So there's no downtime. It's a little snappy when you get it, but there's social implications. So there's no downtime from a procedural standpoint. Doesn't hurt the next day. Maybe sort of the touch. But socially, you need to tell them, hey, you may be a little swollen. You're going to have these flakes that look like coffee grounds on your skin for 3 to 5 days. So there is social implications that you need to educate your patients on. But then look at what happens to the foundation. I mean, just a very clear foundation on the patient's skin picture right. Same thing here. Same thing here. Age spots. You guys get the point. Dyschromias, discolorations. Rosacea, red ruddy hue. That's great for reds. And since Donald Trump is running for president this year, he decided to come in and get an IPL. She's like, is that really Donald Trump? No, it's not. This is, but the first time I saw that picture, that's exactly where my brain went. So let's talk about rosacea. So we got browns, we got reds. Rosacea, look at this, friends. So when you have that hyperemia, remember that term from med school, there's an influx of capillaries, influx of blood flow to an area, happens to scars, happens in patients with rosacea. When you have this hyperemic skin, we could treat that with our IPLs. So look at this compared to this. Look at this compared to this. We have cleared the red foundation, but look what is still persistent. You see this dude right here? See this dude right here? Vessels of caliber, sometimes you get them, sometimes you don't with IPL. So here's your treatment methods. IPL first for the foundation, vasculase, which is also on this, second for the cleanup crew, cleanup in aisle 9. It has to be that order because the vasculase is very efficient at finding red. If the whole cheek is red, you can burn them up. So IPL first to clear the foundation, and then you spot treat with your vasculase. So when I'm counseling this patient on the left, I'm saying, hey sis, this is going to be amazing, you're going to love it. It may require a couple treatments. We're going to start with a light that's going to clear the red foundation. And then anything left over, we're going to spot treat with our vascular laser. And then now we're ready to spot treat. This was after just one treatment with the IPL. Specifically tuned, maximize efficiency. Now this gentleman here, I would say he got near total clearance. Maybe there's one little one right there that I can zap, but maybe one little one right there that I can zap. But the point is, near total clearance in his capillary bed with IPL. So start with IPL, finish with vasculase. Sun-damaged skin, that's brown, just showing you treated, untreated. This is my wife's arms. We do a lot of lakes, sometimes beach. And she's a freckly person. And it was this, I was like, babe, that looks insane. So when we did this, like I said, if you can't find her, there's a few things she does in life. She maintains really, really well. She's got her Forma for maintaining her jawline. She will IPL her eyeballs all the way to her tippy toes in October after the end of the summer. So she does all the things you want your patients to do. So in this picture, she had IPL'd her chest, décolleté, and shoulders last week. Okay? So look at this. So this is clearance compared to she got an IPL the day of this picture. So this is cleared skin. She had done her shoulders, chest, décolleté last week. Then she did the remainder of her arm on this day. And you can see how much it brought to the surface. Surgeons, where are you at? Surgeons? Surgeons, surgeons. Surgeons. Scars. How are you, my friend? It's good to see you again. Scars. Our patients are impatient. We live in America. They want everything they want now. And this is an appropriate, normal scar at 6 weeks. But they want this scar right now. That's 12 months, 9 to 12 months to get there. So what do I use? I use my IPL. Take out the pigment. I don't call this a revision because revision implies something's wrong. I call it a refinement, and we charge for that. It's a scar refinement. And all of my surgical patients have an opportunity to go through scar refinement. And the first thing we do is we start with IPL to take out the redness. Also for my patients, bruising. There's ND-YAGs that are great. Q-switch is great. But if you have an IPL, you can tune the IPL for bruising. Now, this patient was on blood thinners. I told her no 3 times. She begged me. I mean, I was walking out to my car, and she's wrapped around my ankles. I'm like dragging her. I'm like, I'm not doing your surgery. I already told you 3 times. She's been begging. I was like, okay. We'll proceed, but just know you're going to look like you got in an unbelievable bar fight because we can't take you off your blood thinners if you want this really bad. Well, I'm not going to kill you, but you're going to look really, really rough, right? So I'm just working on a small area. I wasn't worried about the patient's health with the surgery. I was just worried about the duration of her recovery because of how she's looked. So this is day 1. No, like, surprise. We kind of talked about it. And so day 7, she looks like this. And she's smiling because she got what she wanted. She's super happy. Now, she looks like she was on the wrong end of someone in a bar fight, right? So on day 7, all these deep purples, greens, we IPL'd this. Look at 3 days later. This is my settings. This is 3 days later. Just look at the deep, dark purple. And then I did it again on day 10. So I did it day 7, I did it day 10. Here's day 14. Now, there's still some hemosiderin staining that we're going to go back and clean up. But my point is, like, if I didn't touch her on day 7, by day 14, she's not looking near this good. So for the surgeons in the room or people doing procedurally based things, this is how I use a lot of this stuff.